Hi, my name is Lloyd Nunag, a Filipino nurse and an advisory group member of Civil Society Engagement Mechanism for UHC 2030. I want to start by acknowledging my colleagues who are working in poor, crowded settings where social distancing may be an impossibility and where regular hand washing is considered as an unaffordable luxury. This pandemic is undoubtedly the most challenging time in generations for teams working in healthcare settings around the world. And I realize that while these times are tremendously challenging, I think it does reinforce the importance of investing in community health. Community health workers, the vast majority of whom are women, are poised to play a pivotal role in fighting the pandemic, especially in low and middle income countries. With vulnerable health systems, community health workers that are equipped, trained, and supported as part of a well functioning health system can help stop the spread of a pandemic. Furthermore, community health workers must also be included in personal protective equipment quantification estimates, as not all estimates take community health workers into account. The need to protect frontline health workers is particularly relevant in places with the worst health workforce shortages. These shortages are even more pronounced in rural areas, which makes protecting community health workers not only a moral obligation but a strategic one as well. In fact, many of the investments in the healthcare workers and community health response in a pandemic are the same as those required to achieve universal health coverage and prevent the next pandemic or epidemic. There is a need to change from hospital-centered approach towards community-centered care, strengthening high-quality healthcare delivery systems in the community will save lives, not just during the pandemic, but always. As a final note, when this pandemic is over, we must not forget the structural and systemic issues around workforce gaps and public health funding. The spread of COVID 19 reveals where investments in workforce development haven't been made. It's not too late to correct this. We just need policies, opportunities, and the will to make it happen. We must remember that investment in healthcare workforce worldwide is a benefit to society and not a cost. It will save millions of lives, enhance global health equity, and result in massive economic and social returns.